I would like to request organizing committee members and executive committee of IMA Khidipur branch to please stay back. Right after this scientific session, we'll be doing a small felicitation program for the organizing committee and executive committee of IMA Khidipur. Thank you, sir. Please continue.
Thanks. Dr. Sanchayan Mandal is from HCG Ipoh Cancer Center.
Mike.
And he is going to speak on cancer awareness. This is a very important thing to note because of the increasing incidence of cancer. If it can be, people can be aware of it and be in time, then probably a lot of hope stays for cancer sufferers. And who has given a slogan, care, close the care gap. So that has to be adopted. And my co-chairperson is Dr. Mumtaz Ahmed.
You welcome, doctor. Please go ahead now.
Thank you, sir. Thank you, Kimakon, to invite me to present like this. I am really honored. So today today is my first session with Kimakon. So I kept as a broad topic as a cancer awareness. That is a very important part on our clinical practice as a medical oncologist. I am attached to HCG Ipoh Cancer Center. So basically my topic will be cancer awareness, recent Indian data and recent updates in cancer. So you all know that after diagnosis of the cancer, we actually become very confused and there is a myth that South India is always better than our West Bengal. So maximum patient runs through it, drain their money and then come back to us after losing much money and fund and come for treatment. And cancer treatment, as we all know, that it is actually long continuous process. It's not like just a course of antibiotic that will end after the session of just 7 to 10 days. So there are many causes. Some are modifiable risk factors, some are non-modifiable risk factors. Modifiable risk factors, as we all know, alcohol, occupational, physical activity. Non-modifiable risk factors, age, genetic factors. Cancer is a malignant proliferation of the cell that goes beyond uncontrolled and invade the many organs. Now this is the most recent USA data which shows male and female pattern of cancer, where the percentage distribution was prostate was higher in male, followed by the lung, colon, then urinary bladder, where in female breast is the number one leading cause, followed by lung, colon and uterine and endometrial cancer. And same in death also. Lung cancer is the most common death in males in USA, where in female also same. Lung cancer is the second leading cause is the breast cancer, the mortality or the death. In India, the ratio is little bit different. In male, we all know due to the chewing of the gutka, pan, tambaku, the lip and head and neck cancer is the most leading cause, followed by the lung, stomach, colorectal. In women, still breast carries the first position, just like the westernized country, and this is the Indian scenario in Globocall 2020 data, where the breast takes the upmost part, first position. Now this is actually the spread of breast cancer across the state, and if you can notice this, the majority chunk of the breast cancer are prevalent in the northern and the southern part of the country. Now, world highest rates of cervical cancer, gallbladder and head and neck cancer are India. Now, question is why India is high populated in this type of cancer. Now, the ratio data showed that 25% cases cause actually are unknown, 10% cases maximum our patients belong to the poverty line, so lack of personal hygiene, some viral infection like human papillomavirus. 40% the majority chunk is due to the addiction in form of tobacco, pan masala, gutka, and some are genetic, poor nutrition, diet, obesity. These are associated factors. These are some signs and symptoms of cancer. Some head to foot, just site specific. There are some starting from the lymph node swelling to cough, or change in the bowel pattern, parectal bleeding or urinary bleeding, or some swelling of the breast lump, or any painful deglutation. These are some site-specific cancer symptoms. Now, what is waiting in the India? That global burden of the India is gradually rising, and 2025 it is estimated to hit the market of approximately 30 million cancer centers, rates, and in coming 10 years it is estimated that every family has 1 or 2% will bear of the cancer. These are some risk factors that are actually the in our international guideline. These are actually the screening pattern of colorectal carcinoma, cervical and breast cancer, and these are actually the points. Due to the running short of time, I am not going into the details. Some are genetic factors, hereditary patterns are there, some are defective genes are there. For that reason, the most of the cancer are already affected. And some other causes like apart from the pollution, chemical, occupational hazard, there are some viruses also responsible, as I already told. HPV virus is one of them. They don't cause not only the cervical cancer, that is the in number 2 position in female, and that can be prevented by the Gardasil 9 vaccine. This type of awareness is lacking among our physicians and general patients. Gardasil 9 vaccine can be taken from the 9 to 45-year-old. Both male and female can take this type of Gardasil vaccine to prevent HPV vaccine. That is, apart from the cervical cancer, it also causes the oropharyngeal cancer, anal, vaginal and penile cancer. And we all know a national immunization schedule already included the hepatitis B vaccine to prevent the liver cancer. And risk from smoking, we already know that apart from this smokeless product like gutka, pan masala, pan, and smoking any type of smoking device like vaping device, cigarette, chutta smoking or bidi smoking, that directly and indirectly cause the cancer. And there are passive and tertiary smoking is also associated with the risk factors. Prevention is wearing the mask. And we know gutka is one of the most important, is highly available in the shops, and this is the most common cause of the cancer in our country. There are some foods that cause the cancer that can be easily avoided if you are aware of it, like processed meat, red meat, salted fish, sugar-rated or very sugar-rated, highly calorific diet or any drink, fast food or processed food. And also some pickle, that is vegetable, that is mustard oil and kept for a long time, and it has been found that there are fungus grown for this pickle mustard oil, and that can also be causative of the cancer. Also the deep fried fruit that I already told, and bottled salad dressing, different types. And also there are some person, they are actually criminal activity they are indulging by putting the injections on the food to keep them preservatives free, and it also lead to the cancer. Obesity is another one of the major cause, and we all know that esophagus, breast, gallbladder, liver, all are directly indirectly leading to the obesity. And now cancer do not differentiate between the who is rich and poor. We all know there are some celebrities, they are also affected with cancer, leaving out the poor generation. So what is the solution? In solution, cancer fighting foods, take the fresh vegetables, stop smoking, drinking, and there are some just simple guideline, breast cancer, way to manage the risk. Factors increasing like aging, obesity, excessive alcohol consumption, tobacco and family history. And in decreasing the risk factors, we all know that physical activity, weight control, avoiding of alcohol or tobacco, and breastfeeding is the important part of breast cancer prevention. Latest in the treatment, cancer adding immunotherapy and targeted therapy. Immunotherapy acts by augmenting immune system, and it has been shown that immunotherapy, their depth of response is much higher than the chemotherapy. Targeted therapy, it target the specific target in the cancer cell and hit the cancer cell and kill them. It has been it has been published in the American Cancer Society that intermittent fasting is also a part of important role in playing the prevention and treatment of the cancer. And those patients who already developed the cancer, in these patients, they actually help to decrease the toxicity of the treatment. Now I am just giving two examples of my real life experience. One is patient 45-year-old. There's a dual primary hepatocellular carcinoma, intrahepatic cholangiocarcinoma. There is a very rare, only 10 to 12 case reports are reported all over the world. This is my own personal patient. So I have started them upfront with they are actually inoperable. They have already came from the Bangalore, and they have wasted much money for their invested for taking the consent for operation and underwent tests and another thing. So I simply started their immunochemotherapy combination, and just after 5 cycles you can see the PET CT scan. The size of the lesion came from the 14 centimeter. The bright light lesions is the first, left corner is the first at the start beginning of the treatment, and right side is the just after 5 cycle, it came to 8 centimeters. So there is a 75% response of the immunotherapy, and patient is really doing very well maintaining the performance status. Next patient is the stage 4 lung cancer, and this patient I have used the targeted therapy. He has the MET exon 14 skipping mutation positive, and I have used the tepotinib. And you see the remarkable response when the patient first visited to me in the left side of the corner. He has a collapsed lung of the right, is a mask. Pleural effusion is there, and see after just 6 months of treatment, now patient is very hale and hearty, come to my clinic just walking by his own, and see all the masses are almost vanished. There is a very good partial response, and he is still on therapy. So these are actually the two examples of immunotherapy and targeted therapy. There's a recent modified treatment that actually increase the overall survival in the cancer patients. And this is the beauty of the investigations in the clinical trial, what we have done for the last few years. So this is the immunotherapy. This is my write-up. You can just go through economic health divisions. So thank you, not much wasting your time. If you have any question, you can just email or WhatsApp me. I will be happy to answer this.